Menopause marks the end of your fertility and therefore the end of periods for you. However, the journey to menopause can be a rocky road with your periods. In fact, one of the first signs that a woman is starting to enter her menopause years is an irregular period. For many women, this can be super concerning and confusing because most women have very regular cycles every single month. Once they start to become irregular, it can be met with a whole slew of emotions. You may be worried that you're pregnant or that something else is wrong with you. Rest assured, irregular periods are very normal in perimenopause. And today we're going to talk about all of those irregularities and what to expect throughout your perimenopause journey. So first of all, let's talk about some changes that you can expect with your period in perimenopause. You can expect spotting, heavier or lighter periods. You can experience changes in the color of the blood, so it could be a darker brown or more red. You can also have longer periods and shorter periods, and more space in between periods, or even a shorter duration of time between periods. Some women also experience worsening of PMS symptoms, including cramping. That one is really common. If you've noticed any of these changes and you're of the perimenopause age, which is in your 40s to early 50s, it's very likely that you are experiencing irregular periods due to menopause. But it's really good to check in with your doctor too, just to rule out any other causes. Now, why do you experience irregular periods in perimenopause? This is a really good question. It's because of hormone fluctuations. So as women age, our ovarian function tends to decline. That is, we're not producing estrogen and progesterone in a cyclical, steady pattern like we used to in our fertile years. So when you reach menopause, estrogen and progesterone levels are extremely low. Your ovaries produce just a very little amount for the rest of your life. In fact, most estrogen that you have in your body in your postmenopausal years is produced from fat. So when you have these fluctuating hormone levels in perimenopause, your periods can be totally affected. So rest assured, that's the cause of perimenopause periods. So while irregular periods are totally a normal part of perimenopause, it can be super frustrating. But fortunately, there are some strategies that we can have in our back pocket to help us manage this frustrating symptom. So first of all, just like you probably did when you were menstruating regularly, always keep your feminine hygiene products available, tampons, pads, Divi cup, whatever you prefer to use. Keep that ready just in case you start bleeding unexpectedly. Similarly, a lot of women like to invest in some black underwear just to make sure that they don't soil their nicer, lighter color underwear if they have spotting. Now, if the late periods and missed periods totally get to you and you're having intercourse, don't hesitate to use a pregnancy test. Peace of mind is wonderful, and if you have consistently missed periods and you're not certain if you're pregnant or just experiencing perimenopause symptoms, check with your doctor. They can run a pregnancy test and blood test as well to see if it's perimenopause or if it's pregnancy. Finally, it's important to note that irregular periods can be caused by other conditions. So uterine fibroids or polyps, endometriosis or endometrial hyperplasia, pelvic inflammatory disease, polycystic ovarian syndrome, birth control pills, stress, or uterine or cervical cancers, or even thyroid conditions all can cause irregular periods as well. So if you are experiencing irregular periods, this is a really good time to check in with your doctor to rule out other conditions, as well as to talk about how to manage symptoms of perimenopause and what to expect along your journey. Now, some women that experience severe irregularities in their period may inquire about hormone replacement therapy or even birth control pills just to steady out those estrogen and progesterone levels. So this is a great time to meet with your doctor and talk about all of your options for managing irregular periods in perimenopause.